prompted by several local doctors in conjunction with a long-time vision of Dr. John Rosenberg and Chairman of IMRC, Manzoor Gori. IMRC organized the India Health Initiative. The objective is to bring together a team of medical staff from the USA to travel to the rural areas of India to provide desperately needed healthcare to the local destitute Muslims and minorities, to provide basic education in healthcare with an emphasis on preventive healthcare, and to provide technical training to the local doctors and medical personnel. Brother Manzoor Gori, in collaboration with MESCO Hyderabad, spearheaded the planning, organizing and implementation of this initiative. IMRC's pilot medical camps were conducted in the month of January 2010. Medical resources from USA and India converged in a coordinated fashion for the first IMRC India Health Initiative. A combined total of 40 physicians volunteered at the various camps. The doctors were from the specialties of pediatrics, emergency and critical care, cardiology, gynecology, orthopedics, diabetics, ophthalmics, ENT and general medicine. An extensive pharmacy was set up. 6 medical camps were conducted over a period of 2 weeks in Uttar Pradesh and Andhra Pradesh, treating over 6,733 patients, among which 1,500 patients received eye care. IMRC and Sahayata Trust coordinated all the medical camps.
It was the pilot project for the IMRC. Again, the purpose was not just to provide the primary health care, but also bring the physician, American as well as our non-residents Indian physicians, large community from India, who can experience and see the need for the first time in these rural villages. And our experience has been very positive.
The first camp was held in cooperation with Jahangirabad Educational Trust in Jahangirabad. In a span of 3 days, the medical team treated 1,333 patients. Unfortunately, hundreds were turned away due to lack of time. 5 more camps were held in Andhra Pradesh. 3 medical camps were conducted in flood-affected Kurnool district in cooperation with Fauzia Kareem Foundation. These medical camps were conducted in Kurnool town, Wailgod and Atmakur village of Kurnool district, serving 3,900 patients. A training seminar was organized by IMRC for the doctors and students of Kurnool Medical College. More than 80 doctors participated in the event. Another training seminar was organized at MESCO Diagnostics Center for medical personnel and students in Hyderabad. Last 2 medical camps were conducted in coastal Andhra region of Chintalpudi village in West Godavari district and Chandralapada village in Krishna district, serving 1,500 patients. IMRC's goal was to treat 4,000 patients in 2 weeks. The need was so immense in these undeserved areas. Everyone doubled their efforts and worked for long hours to serve as many patients as possible. Dr. John Rosenberg, the team lead for the US medical team, reported that this was a very successful pilot project and will lead to an improved model for future medical camps.
I learned a lot. I learned a lot about India. I learned a lot about the medical conditions, the economic conditions. I saw a lot of beautiful places. I saw many monkeys. I saw crops and ate food that I'd never had before. This kind of work gives me more pleasure than anything that I've done. I had a long career in emergency medicine, but I used to save my vacation time and my money so that I could go abroad to places where people need care, where I could be of use. And now that I'm retired, I've had the opportunity to do it even more. I thank their families who have helped so much, worked so hard, and lost so much sleep over this difficult assembly of medicines, doctors. It's been a tremendous experience, and I recommend this to physicians and medical personnel and anybody who has the will and the energy to do this.
The medical team observed that patients in Uttar Pradesh were poor economically, which also reflected in their poor health conditions. They also concluded that many illnesses were preventable and the medical conditions are propagated mostly because of poverty, ignorance, and lack of transportation. The chief concern was the impact of infectious diseases such as malaria, pneumonia, and bronchitis, which are rampant in these areas. The problem of tuberculosis has reached epidemic level. Apart from these diseases, malnutrition and untreated surgical needs present a grave challenge to the private as well as governmental health agencies and organizations. If neglected, these conditions will worsen and deteriorate into a greater public health menace.
Our physicians who came from US were able to correct the diagnosis and provide life-saving support. For example, a 12-year-old girl was given by the local physicians the diagnosis that she could never be able to walk. Dr. Naseem Sharif, Dr. Rosenberg, and other physicians had a conference and came up with a complete plan for the recovery and what needs to be done. So you can imagine the kind of relief these families were getting. We were able to provide support. For example, a girl who was 14 years old who was almost hyperventilating and could have died with the hemoglobin less than 4 was diagnosed and immediately provided with the blood transfusion. So there were 70 cases just in Jahangirabad alone which needed the follow-up. So we are doing all this and we hope that we will be able to continue this project with the support of many hundreds and thousands of physicians from India. We look forward for your cooperation and support for future programs. This program would not have been possible without the local cooperation and the support, especially Dr. Fakhruddin from MESCO, who organized the local support and the logistic. For example, providing supplies of the medication, purchase, transportation, blood test, X-ray, all these things can be done. Even though we had some deficiencies, but I'm sure it can be improved as we go along.
The total cost for this health initiative was $20,000. A total of 6,733 patients were treated, of which 1,500 patients received prescription eyeglasses at the average cost of $4 per patient. 15% of the patients who were treated required follow-up medical attention, additional lab tests and surgery. The medical team traveled 2,200 miles across India by road and flight. 50 paramedical staff and more than 100 volunteers helped in organizing the medical camps. IMRC partnered with government agencies and local non-profit organizations for conducting these medical camps.
And I only wish that we should be able to repeat these camps at least once in 6 months so that follow-up can be done, and inshallah we will try to do our level best with the help of IMRC and with the help of the doctors team, which are going to come again and again to India and help us.
Our first India Health Initiative demonstrated a workable and sustainable model for medical outreach to the underserved and needy populace. It also left us a feeling that there is a lot more to be done. We urge our medical professionals to join us in our next medical excursion. To our dear brothers and sisters, please share your compassion by donating generously to support IMRC's India Health Initiative.